Hello, my name is Tomas Malave, Outreach Coordinator with NJHealthProgram.com. I'd like to thank you for taking out a few minutes of your day today to educate yourself on the Affordable Care Act, or ObamaCare as most people know it. What we're doing today is a community healthcare outreach. It's an affordable care overview and comparison to give you the proper information on the Affordable Care Act and other options that are available for you. We work hard to make sure the public at large is informed so they can make the right decisions. And like our motto says, no politics, no excuses, just solutions. Now, what is NJHealthProgram.com? NJHealthProgram.com is a community-based organization that is dedicated to addressing major social issues and providing a solid solution for the public. We work with a number of businesses and organizations to provide outstanding quality services while educating the public of the options that actually exist for them. Some of the services NJHP provides are complete affordable health care, medical, dental, vision, prescription, chiropractic, and emergency services. Also affordable home services such as air duct cleaning, UV light cleaning, dryer vent cleanings for safety, and emergency health monitoring for families. Here's an example of some of the outreach that we've done in terms of indoor air quality and also educationally. Now, what is the mission of the Affordable Care Outreach? Well, one is to provide the public with the proper information about the Affordable Care Act so they can make an informed decision. A lot of people have some misconstrued notions of what the Affordable Care Act is or ObamaCare is. A lot of people think they're going to get free health care, or they're just not really sure exactly how the program works, and that's what we're here to help them with. Two is to help those in need to understand what the right fit is for their medical needs. Each home has different situations going on in them, different circumstances. Some families just need more preventative things, checkups, things of that nature, while other families need ongoing medical treatments, prescriptions, things of that nature. So we help them to discern exactly what that fit is properly. Three is to provide those in need with complete benefits package immediately. So if you're not going to wait on ObamaCare and the Ameriplan is a better fit for you, we can get you started with that immediately. You can see the dentist today and don't have to wait. Now, what is ObamaCare or the Affordable Care Act? In a nutshell, the Affordable Care Act is a law passed in 2010 with the intention of making health insurance more affordable and accessible for the public at large. Some components to the act are already active, while others do not begin until 2014. Now, what does the right fit mean? Well, how much coverage do I really need? That's where we start at. Do I require ongoing treatment such as care, prescription drugs, etc., or do I only need checkups, preventative maintenance, etc.? And also, can I afford to pay the premium? These are the most important factors in determining what your right fit is. Now, what are the most popular pros of the Affordable Care Act or Obamacare? Okay, first is children stay on their parents' insurance until they're 26. Excellent for post-college graduates who are trying to find a job out here in this economy. Those with pre-existing conditions cannot be denied. So in the past, if you've had the money for your premiums before but could not get the insurance because of pre-existing conditions that you've had, that will no longer be an issue and the door will be open to you. Also, it extends the Medicaid ceiling so that 13 million more impoverished citizens will have access to free health care, which if you're a people person and it's a good person, that's great for everybody. Now, some of the most popular cons of the Affordable Care Act are as follows. Though health care will be made more affordable, the dollar amount required for coverage is still expensive, and we'll get into that a little bit more a little bit later. Hospital stays are only covered up to $12,000, and that can get extremely expensive as well. Those who still cannot afford health care will be forced to pay an income tax of 1% in 2014, 2% in 2015, and 2.5% in 2016. Also, households that make more than $88,000 combined will get no government subsidy, so you're out there on your own to pay for your entire premium. And right now, the Obamacare or Affordable Care Act does not require dental or vision, so some of the quotes you might be getting initially will be a little bit lower because they do not include dental and vision, which is a more comprehensive package, which is going to cost more money. Now, how do the qualifications for the Affordable Care Act work? Okay. Well, one is based on income and the number of people in your home. And then also there are multiple coverage tiers, and the higher the tier, the more expensive. You have a 60-40 tier, which is considered a bronze, 70-30 tier, which is considered silver, 80-20 tier, which is considered gold, and 90-10 tier, which is considered platinum. Now the 90 denotes how much the insurance is going to pay, and the 10% denotes how much you're going to pay. So the left side, again, is how much is going to be paid by the insurance, while the right side is what is going to be expected for you to pay out of pocket. And the higher tier that you go to, the more expensive your premium is going to be. Now, how do I get an estimate of what I would expect to pay for Obamacare or the Affordable Care Act? Well, NJHealthProgram.com utilizes the cost calculator designed by the Kaiser Family Foundation. The Kaiser Family Foundation is the premier nonpartisan independent research firm committed to the overview and assessment of healthcare policy. Here's an example of the cost calculator here. What we do for people individually when they call up and they want to get a quote, we'll ask them a few questions such as their income, their age, the amount of people they have in their family, whether they're working or not, and if their employer offers coverage, and we can go ahead and give them a pretty close estimate of what they would expect to pay from that based upon this cost calculator. Additional estimates from the cost calculator. Be honest. Can you afford this? Does this fit? And remember, this does not include dental or vision. Now, for a single person whose household income is between $35,000 to $80,000 a year, you're looking at least $287 a month for health care. But again, that does not include dental or vision. So conservatively, we're going to add another $200 to that. It could be much more, honestly, but we're just giving you a conservative figure to kind of give you a base idea of what you'd be looking to pay. So your average is going to be costing you about $487 a month for your health care. Can you afford this? And be realistic with yourself. Okay, now there's some more additional estimates from the cost calculator, and this is what it would cost for a family. Family of 4 cost estimate. And this is if you have a $60,000 household income combined. So this can be you and your wife or you and your spouse making $30,000 apiece, or one makes 40 and one makes 20. But we've just made it to $60,000, okay? So at $60,000 a year for your household income, you're looking at an additional $411.41 per month, not including dental or vision, so you can add another $200 to that. So you'd be looking at about $611.41 a month. And again, that $200 is a conservative figure for, upping your premium. So again, ask yourself, is $611 something I can afford, and does it make sense? Does the Affordable Care Act make sense for me? If yes, congratulations. You have fit into the structure of the ACA and now only need to wait until January of 2014 to start your enrollment process. Okay, all the states are going to have a different enrollment process, so you're going to have to pay attention, depending on what state you live in, to the process to get everything rolling for you. Now, if this does not make sense for you, if these premiums seem out of reach or too high, we have another proven affordable care option that is actually available now for you. Now, what is Ameriplan? Now, here are some facts about Ameriplan. Ameriplan is a discount medical program organization, or DMPO. We arrange for our members to have access to medical, dental, vision, chiropractic, and pharmaceutical providers who have agreed to offer their services at a negotiated discount off their usual customary fees. Ameriplan is a 21-year-old A+ Better Business Bureau rated company with a proven track record and large network. It has an average of 60 to 80% discounts across the board for one low monthly payment. Your premium also includes all of the household members, and you have immediate access, so there's no waiting period. How does the program work? Okay, well, for $49.95 a month, this includes the entire household again, you're going to get medical, dental, vision, prescription, and chiropractic coverage. You're going to get hospital advocacy, so any bill that comes from the hospital that's over $2,000, you're going to refer to a company that we call the Carers Group, and they're going to negotiate your bill down based upon what you make to something reasonable. So you have them in your corner. You get doctors and in-office visits, medical services, and what we call a Meridoc. It's called telemedicine. So basically, if you have any kind of emergency at any time of night, it's a $17 call. You can get to a doctor, and you can get a prescription written for you or any advice that you need at any time of the day. So you always have excellent access. Now, one of the major questions about this is, what is my copay? How much do my services cost? So what we've done here is we put a fee schedule here, a general dentist fee schedule, so you can get an idea of what you'd be looking to pay with this program specifically. So if you look at the top here where it says periodic oral evaluation, if you don't have any kind of coverage, you're looking to pay an average of $73. With Ameriplan, you're paying an average of $15. That's an 80% savings. A comprehensive oral exam for your first visit. If you don't have any coverage at all, you're looking on average to pay about $130. With Ameriplan, you're looking to pay about $39, or 70% savings. So you can see there just from those two that the program does work, and you can have a better understanding as far as the fee schedule is involved. Now, for something more immediate like a root canal or anything like that nature, which you would be looking to pay for a root canal, if you were not covered, you'd be looking over $1,000. With Ameriplan, you're looking at about $400, so you're looking at about a 61% savings, and that's right about on par dental wise that you're looking at with any kind of insurance program that you'll be paying a much higher premium for. Okay, so those are just some of the examples from the fee schedules from the dentist, but you can look more into that as far as our resources, and we can get you more numbers for other things in depth. And also the Ameriplan website has a lot of that information on it as well, but feel free to give us a call if you want more information on this. Okay, now again, for the Ameriplan review, it's just $49.95 a month, so it's one fee. That one fee covers the entire household, and it includes medical, dental, vision, prescription, and chiropractic coverage. There's no waiting period, no credit check or physicals to take, and then you have an average of 60 to 80% off all your services. Now, what's the better fit, and how do I know? Okay, you may want to try taking advantage of the Affordable Care Act options if you have a chronic illness, have multiple household members with chronic health issues, can afford the premium cost. This is very important here. Project that your monthly medical expenses will exceed the cost of your premium. This is the most important factor in the decision making that you're going to have here. A lot of people have an illusion with the word insurance and what it covers and what it actually doesn't cover. But if your monthly medical expenses will not exceed the cost of your premium, then it doesn't make sense for you to incur that cost. For example, there's no reason for you to be paying $800 a month for medical services if you're only going to use $200 worth of medical services a month. If you're going to a checkup or something like that, you're just wasting money. So you're going to be starting your medical bill every month at $800. Okay. And finally, need ongoing medical treatment that is not routine, preventative, or emergency. So you're going to have to do a little bit of research in terms of if you have chronic illnesses to see what the Ameriplan fees are versus what you're going to be expecting to pay on the open market. Okay. Again, what is the better fit? How do I know? You may want to try taking advantage of Ameriplan options if you are in need of immediate coverage. If you need to go to a dentist tomorrow because you need a root canal, or you're having any kind of other medical issues and you want to get covered immediately and pay decent cost, this is the excellent option for you. Have multiple household members with chronic health issues. Now, it's kind of the same thing as the other one. This was on the other slide too. But if you do have multiple household members with chronic health issues that can be broken down or affordable, again, this requires a little bit of research. Ameriplan is excellent because we cover a wide range of issues, and even if you have a pre-existing condition, it doesn't matter. It's still covered immediately. 3, can afford the premium cost. That's at $49.95 a month. Again, another important role in this is to project that your monthly premium will exceed the cost of your monthly medical needs. Okay, so again, you need to make sure that you understand how much that you're going to have to pay per month for your actual medical needs. If you're just doing things more routine, this is where you want to stay. Okay. Now, for more information, go to njhealthprogram.com. You can get all the information there. There are excellent videos, more in-depth information on the Affordable Care Act, also an Ameriplan FAQ. Also, you can call 855-866-7153 at extension 0 for the health programs, and we'll be happy to get you enrolled or answer any other questions that you might have. I'd like to thank you for taking some time out again to check our brief overview of the Affordable Care Act and Ameriplan. If you have any other questions, please feel free to reach out, and you have a great day.